Good afternoon, dear colleagues, if you are in Europe. Good morning if you are in North or South America. And good evening if you are listening from Asia. Thank you all for joining this webinar. For your information, there is the possibility of typing in questions. You should have a Q&A bar at the bottom, right, where you will be able to type in your questions, but the questions will be answered at the end of the webinar in the Q&A session. This material is also being recorded for access after the webinar at any time. So this is a very exciting time, and it's an exciting topic because we have a fantastic new device that we were going to be discussing during this webinar, and I will be sharing with you as being the first doctor in Europe having experience with the Vbeam Prima, my experience so far. A bit of introduction with regards to the vascular lasers and the device that we were going to be talking about. These are the wavelengths that we generally tend to use for vascular purposes. One of the common ones is the 532 KTP. The 595, the PDL, is the gold standard vascular laser that is currently used, as well as some devices that have a diode, and of course the Nd:YAG that we will also be discussing. The choice of the wavelength in vascular laser is important, and whilst there are certain peaks for the hemoglobin in terms of absorption for vascular purposes, one of the key things is to ensure that this wavelength is not too short, whereby the depth of penetration is a limitation and too much of that light will be absorbed on the surface, which is the epidermis, potentially creating problems at epidermal level. On the other hand, if the wavelength is too long, then there is less absorption by hemoglobin, and therefore to compensate, higher energy is needed. And this is the reason why the wavelength 595 nanometer, which is used in pulse dye laser, is an ideal wavelength, because it is not short in terms of too much absorption at the epidermis, and not long enough in terms of lack of absorption by oxyhemoglobin. So it sits nicely between the short and the long wavelength, where there is adequate penetration to most of the vessels and the skin, with less risk in terms of epidermal overheating and less wastage of that energy. This diagram really illustrates that one of the key principles, that with the visible light and the near-infrared wavelengths, that as the wavelength increases, the depth of penetration increases. And one of the key things here that you will see, the reason why the pulse dye laser at 595 nanometer functions better than the KTP at the wavelength of 532 is because it has a longer wavelength, and that allows for deeper penetration and less absorption by the epidermis, and therefore there is less risk of overheating the epidermis with potential epidermal problems. So for the same spot size, if one to compare the 595 nanometer wavelength with the 532, there's superiority in terms of depth of penetration with the 595 and increased efficacy and safety compared to 532. On the other hand, for very deeper vessels where the depth of penetration is of importance, the Nd:YAG at the wavelength of 1064, 1064 nanometer will be more appropriate because of that depth of penetration that you get, because it's a longer wavelength. And really, Candela as a company prides itself in leadership when it comes to science and the application of the science and the physics in clinical practice. Ever since the inception of the photothermolysis theory in 1983 by Anderson and Parrish, the first vascular laser, the first pulse dye laser, was invented. And at its time, it was invented for capillary malformations. And what you can see here from this slide is the evolution of the pulse dye laser over the years with different wavelengths, starting initially from 577 nanometer. In 1996, the choice of 4 wavelengths was studied, and it was chosen that the 595 was the best wavelength in terms of adequate depth of penetration with good uniform coagulation and heating of the vessels with less risk on the epidermis. And that's why since then, with the Vbeam Classic moving forward in 2000, the choice of the wavelength 595 nanometer was chosen. Most of us who are dealing with vascular lasers should be familiar with the Vbeam Perfecta, which is an absolutely outstanding laser in vascular use, which is a 595 nanometer. But we are very pleased to announce the arrival of the new Vbeam, which is the Vbeam Prima. This is the Vbeam Perfecta, which is the present and past, which has multiple indications beyond primary vascular conditions, and you can see different spot sizes. And one of the unique things for the Vbeam is the linear elliptical spot size, which is the 3 by 10 millimeter spots, which you can trace the individual linear telangiectasias and vessel, and also the tunable pulse widths, whereby you can choose very short all the way up to longer pulse duration, depending whether you would want purpura or coagulation matching the vessel diameter. So what is different then, since we have the Vbeam Perfecta? Well, so now moving on to the Vbeam Prima. One of the first differences between the Prima and the Perfecta is the addition of the 1064 nanometer Nd:YAG wavelength. So we are dealing in the Vbeam Prima with 2 wavelengths, the 595 nanometer pulse dye and the 1064 nanometer Nd:YAG, which, as I explained earlier in one of the slides, that the longer the wavelength, the deeper the penetration. And in this case, this means that within one platform, you will be able to treat all vascular conditions in terms of depth, where if you have a deeper component of the vessel, such as venous blood, leg veins, then you'll be able to choose the 1064 nanometer wavelength, which will penetrate deep. And for most of the other more superficial vessels, you can choose the 595. So within the same pathology, within the same patient, within the same treatment, some areas might require the 595 nanometer wavelength, whereas some other areas may require the 1064 nanometer. And this is a huge advantage and addition, and the addition of the 1064 nanometer allows for this customization of treatments based on the depth. One of the other very exciting additions with the Vbeam Prima is the 2 methods of cooling. Now, Candela as a company prides itself to this patent of DCD, which stands for Dynamic Cooling Device, which is the spraying of tetrafluoroethane spray that is a cryogen spray that selectively and spatially cools the epidermis without the risk of vasoconstriction into the papillary dermis, the vessels that are found in the papillary dermis, and you will be able to dial in the amount of cryogen spraying and the time between the spraying, depending on the pathology and the skin type and the fluids that you're using. Most of us who are familiar with Candela devices are extremely happy with the DCD, which has superiority over other methods of cooling. Now, the other advantage is the contact cooling, which is the EverCool, and this is particularly useful when there is brown targets or dyschromias, where the energy is required also to be absorbed at epidermal level. And from my experience also, this is particularly useful for patients who are extremely sensitive and find the spraying with the DCD somewhat sensitive to them with the use of the applying gel and the contact cooling that decreases the sensitivity and increases patient's comfort. You will see from the slide that you are able to dial in the degree of temperature that is required with the Evercool, from very cold to somewhat less cold, so 10 degrees, 15 degrees, or 20 degrees. And that will depend on the skin type, that will depend on the degree of chromophore, depends on the fluids that are used. So now within the same machine, you have two wavelengths, depending on the depth and your target of the vascular. And you also have two methods of cooling. Now you may want to say that you're very familiar with the DCD and want to continue with the DCD, which is absolutely fine. But for those clinicians who are more used to contact cooling and prefer the contact cooling, then that choice is there. In my practice, personally, I am using both the DCD and the contact cooling, and I rely on the contact cooling for very sensitive patients, or where I'm also treating a mixture of vascular and dyschromia, such as in conditions of poikiloderma savat. One of the other advantages of the contact cooling is when you would like to apply gentle compression, such as, for example, in a venous lake. The contact cooling Evercool handpiece is particularly useful because in addition to having the cooling, I'm able to just gently compress and reduce the overall target for the initial shot. So far, two key things about the Vbeam Prima: the dual wavelength of 595 and 1064, and two methods of cooling, the DCD, which is a patented method of cooling of Candela, and the Evercool contact cooling. One of the other very important things is the dye, the rhodamine dye that is used in the pulse dye laser 595 components of the Vbeam Prima, which is more efficient, lasts longer, and more importantly, you will be able to track the amount of dye that is left. So on the screen, you are able to see that there is this tracking system whereby you'll be able to track exactly how much dye that is left, which will allow you to anticipate for further dye, and that is a very unique thing in terms of the use of the dye and the efficient use of dye. The pulse dye laser in Candela has a unique micropulse technology, which means that the individual pulse is divided into small, short micropulses, which is particularly good when it's used in the subpurpuric mode, for example, for rosaceas and poikilodermas and scars and some other conditions whereby you would want to have a subpurpuric response and mode. Within the same pulse, the energy is divided into micropulses, which allows for greater safety and that subpurpuric threshold. And this is in the Vbeam Perfecta as well as in the Vbeam Prima. One other addition in the Prima compared to the Perfecta is the increased spot size. We have now 15 millimeter spot, and this diagram shows that if you change from a 10 to a 15 millimeter spot, you are increasing the area by 125%. What does this mean in clinical practice? In clinical practice, this means speed, whereby the coverage area will be able to cover much faster, but also, in addition to that, it's the depth of penetration. This slide shows an important phenomenon in laser physics, and that is, with a small spot size, there's less depth of penetration, and there is more wastage and scattering of the light. Whereas for the same fluids, the large spot size, the depth of penetration is deeper, and there is less wastage and scattering. So as you can see, for the same fluids, by simply changing the spot size on the large spot size, you are going to have more effect. in practice, that means for a large spot size, we can use lower fluences, be more gentle on the surface, the epidermis, and reach deeper targets. So the way to look at it is, for example, if we're treating a port wine stain or rosacea, by simply maximizing the spot size and using a 15 millimeter spot, we require less amount of fluids, which will mean less heating of the epidermis, that is increased efficacy and safety and protection of the epidermis, but also deeper penetration of the light, and therefore we are able to treat the deeper component first, and as we progress further with the treatment, we are able to then decrease the spot size and potentially treat the more superficial components. This is something that we are able to do by simply having a large spot size of 15 millimeters. So there are two advantages of the large spot size, and that is speed and coverage, which means that fewer shots are required to treat a large area, but also more depth of penetration with lower fluences required for that larger spot size, and therefore increased safety with regards to the epidermis. This table shows one other additional feature with the Vbeam Prima, which is increased energy. So as you can see with the Vbeam Perfecta, the maximum largest spot size is 12 millimeters, whereas with the Vbeam Prima that's 15 millimeters. But the amount of energy that you can use is higher, which is up to 12 joules. So we have a larger spot size, but not at the cost of lower fluence. We have a larger spot size plus higher energy, whereby if needed and required, we can use higher fluences too. And for those of you who are familiar with the Vbeam Perfecta, this table once again illustrates some of the key differences between the Vbeam Perfecta and the new Vbeam, the Vbeam Prima. So we still have the 595, but with the Vbeam Prima we have the addition of the 1064. We have a large spot size, 15 millimeters. We have higher energy and maximum fluence of 12 joules. We have more efficient dye that we are able to track, and we have two methods of cooling, the existing DCD in the Vbeam Perfecta, as well as the Evercool, which is the term used for contact cooling. One of the other advantages is the zoom handpiece that allows you to change the spot size with increments of 0.5 millimeter. So with the Vbeam Perfecta, currently you have a 5 millimeter spot, for example, and you have a 7 millimeter and a 10 millimeter, but you cannot choose 8 millimeter or 4 millimeter. With the Vbeam Prima, you are able to choose a 3, 3.5, 4, 6.5, 8, 8.5 millimeter, and you are able to adjust the spot size with your handpiece with increments of 0.5 millimeter, which means that particularly for smaller targets and for vessels, you are able to dial in exactly the spot size that is required. I just want to highlight, in this slide, I want to highlight one feature. If you will look at the 1064 and the YAG laser, two things I would like to highlight here. One is the frequency up to 10 Hertz, which is speed. And the other feature is the difference in pulse duration in 1064, where you can go up to 60 milliseconds, but more importantly, you can go in sub-millisecond modes in the microsecond mode. And those of you who are familiar with certain techniques, whereby you use a large spot size at high frequency in a sub-millisecond mode in the NDI in multi-passes, so-called painting technique for heating the skin or rejuvenation, this will allow you to do exactly the same with the Vbeam Prima. So with the Vbeam Prima, you can use the 1064 NDI in the long pulse modes, but you can also use it with the high frequency, higher hertz in the sub-millisecond or so-called microsecond mode in a painting technique for some applications such as acne, rosacea, diffuse redness, flat scarring, rejuvenation, or tightening in combination with other treatments. This is often something that is not often discussed or talked about, but nevertheless is a great advantage of having this short pulse duration and higher frequency, the Nd:YAG and the Vbeam Prima. So some of the other features, as I already explained, the zoom handpiece that you can incrementally increase by 0.5 millimeter spot size, but there is also a remote Wi-Fi connectivity whereby you'll be able to, whereby the engineers will be able to have access to the system, and a very good, useful guided user interface where I have reviewed all the settings, and they are extremely helpful, and it's a step up from the current application's user guide interface that is in Vbeam Perfecta, with newer indications such as, for example, post-filler bruising, whereby the settings will be given too. Calibration is another feature whereby there's only a single use of calibration, which means once you switch on the Vbeam Prima, then you just need to calibrate it once, and if you're changing spot size or you're changing pulse duration or fluence, you do not need to recalibrate again. This is currently the case with the Vbeam Perfecta, but with the Vbeam Prima, there is only one single calibration, regardless of changing spot size, fluence, or pulse duration. So what can we use the Vbeam Prima for in clinical practice? Well, this diagram illustrates essentially in terms of the colors, that's everything that is red in terms of the vascularity, such as port wine stains, rosacea, telangiectasias, acne vulgaris. You are able to treat dyschromia and benign pigmented lesion using the contact cooling handpiece. But also now we have the addition of the Nd:YAG 1064. We are able to then treat venous blood, which is rich in deoxyhemoglobin, which particularly absorbs 1064 well, but also, as I explained earlier, because of the longer wavelength, there is deeper penetration, and some other non-primary vascular conditions that can be treated with the pulse dilator. This is the way I always like to explain it, that the pulse dilator in clinical practice can be used in so-called primary vascular conditions and non-primary vascular conditions, or conditions with a vascular component, but they are not primarily vascular, and by treating that vascular component, you can get improvements. Examples of these are warts or verrucas, stretch marks, striae rubra, scars in terms of scar prevention, as well as active scar management, inflammatory acne vulgaris, nail psoriasis. These are all non-primary vascular conditions which can certainly be treated very well with a pulse dilator, and there are numerous articles to back this up. So once again, this is just a selection of some of the conditions that can be treated with the Vbeam Prima, where all of these conditions have studies to back this up. I would like to spend a minute discussing about the Nd:YAG, because this is often a wavelength that doesn't get the same amount of attention as the pulse dilator in vascular users, but the long pulse Nd:YAG can certainly be used for the deeper vascular components, as I explained, because of the longer wavelength and therefore deeper penetration, but particularly useful for venous blood, and that is because venous blood is rich in deoxyhemoglobin, which absorbs the 1064 wavelength very well. But there are certainly other applications, such as acne vulgaris, diffuse redness or rosacea, warts, verrucas, tightening, rejuvenation, and scars, where studies have been published using the 1064 long pulse Nd:YAG or in the microsecond pulse. These are some of the clinical images from our colleagues in the United States who use the Vbeam Prima, and here you will see that the ever-cool contact cooling handpiece was used, and that is because there is also surface dyschromia, so where there is brown and red, the contact cooling will be more superior compared to the DCD, and these are the parameters that are used. You will see that the pulse duration that was used is long, and that is to avoid a purpuric response in the blood vessels. Some other very impressive results in terms of treatments of telangiectasias on the face, and again with the condition of rosacea. Rosacea again, one of my colleagues in the US. And this one but with very clear improvements with the telangiectatic and erythematous components, in this case using the largest spot size, the 15 millimeter spot size of the pulse dye laser, which led to the first publication that is published in Lasers in Surgery and Medicine using the novel 15 millimeter spot size, the pulse dye laser in the management of rosacea. And you are able to get a copy of this article from your Candela contact. So, to summarize, what are the key unique features of the Vbeam Prima? We have two wavelengths, the 595 and the 1064, the latter for the deeper components of vessels and the venous. We have two choices of cooling, the contact cooling as well as cryogen cooling, DCD. We have more efficient dye with longer dye life that we are able to monitor and track, faster speeds. We have more energy with a larger spot size of 15 millimeter and higher frequencies. This is my approach to vascular treatment in terms of choosing the setting. That first you will determine the wavelength. So as I explained, for most of the vascular conditions on the face, the 595 will be adequate. For venous blood or for deeper pathology, then the 1064 is chosen. You then choose your spot size for linear vessels. The linear elliptical spot size of 3 by 10 millimeters is ideal. If your target is deep, then choose a large spot size. If it's a very small superficial target, then you can choose a smaller spot size. Then you will determine the pulse width, and that is either if you want purpura, then you will go for short pulse duration with a pulse dye laser, or if you're looking for vessel coagulation, then your pulse duration will have to match the diameter of the blood vessel. Then you will choose the fluence, because the fluence will depend on the chosen spot size and the pulse duration. And lastly, you are going to have to adjust the cooling, which essentially means that if you're using very high fluences, then the cooling is going to have to be increased. And alternatively, when the fluence is lower and a lighter skin type, overcooling might potentially compromise the results. So I have had the honor of having the first Vbeam Prima outside the United States, and I'm very pleased to say that the United Kingdom is the first country in Europe to have the Vbeam Prima, and my experience has been extremely satisfactory, and very, very pleased and impressed with this fantastic machine. Here you can see this is a hemangioma, and therefore you'll be using a large spot size. This would limit the number of treatments that is required with 15 millimeter spots. This was after one single session where there is a combination of the linear elliptical spot size to trace the individual vessels, and then a large 15 millimeter spot size to treat the entire face, and the patient was extremely happy after one treatment session. Venous lakes like these can be safely treated with the Vbeam Prima, and in this case it will be the 1064 wavelength for this venous blood, and the advantage here that you can use the contact cooling, whereby you can apply gentle compression initially to reduce the amount of targets and heat up the venous lake. And as I say, this indication of bruising, whether it's traumatic or post-injections, is also in the guide interface, and you can hear clearly, very impressively see after 24 hours, you can actually see the rings of the spot size, and in 72 hours it's completely clear. Using a large spot size in this part of the body will allow for better depth of penetration. Periorbital veins, which will be treated with the 1064 nanometer, and here is why the handpiece, whereby you can incrementally adjust and increase the spot size by 0.5 millimeter spot, is incredibly important, because in some parts you may want to use a 4 millimeter spot, and in other parts you may want to use a smaller spot size, a 3 millimeter spot, and you are able to exactly match that and do that with the Vbeam Prima, with the handpiece that can be incrementally increased and adjusted by 0.5 millimeter spot size. Scars that are hypertrophic or keloidal, because of the depth of penetration and you want to get deep, this is where a large spot size of the 595 can work very well, and therefore, and thereafter, once the scars are flatter, then you can use somewhat smaller spot size. But the large spot size in this case will allow for good depth of penetration. And often here there will be a combination of approaches, but the Vbeam Prima will work wonders in this case. This is one single treatment for port wine stain using the 15 millimeter spot size and the contact cooling. The patients called me afterwards and said he was very happy and very impressed with the results. You can see very nicely that there has been very good reduction after one single treatment. So what has been my personal experience using the first Vbeam Prima in Europe? It is a great machine with having the versatility of the addition of adding that 1064 nanometer. I am now able to, in one platform, treat deeper vessels. The 15 millimeter spot size is great, and I'm using it for poikiloderma, civet, for rosaceas, for port wine stains, hypertrophic scars. The contact cooling handpiece is particularly useful when there is dyschromia and for patients with sensitive skin. The once daily calibration makes things much easier, and I would summarize by saying the Vbeam Prima is a perfect, complete vascular platform to treat all vascular conditions. This is my last slide, and once again we'll go through the key features of the Vbeam Prima, and that is having two wavelengths, 595 and the 1064, with two methods of cooling, the DCD cryogen spray as well as the contact cooling, a larger spot size of 15 millimeter spot with higher fluence, with smarter use of the dye and a tracker of monitoring the dye, a more convenient once daily calibration, as well as a very good updated guided user interface. So I would like to thank you all for listening and joining the webinar, and we now have time for questions and answers. If there are any questions, they can be typed. So one question is about the combination of 595 and 1064 in a single patient. Now that depends on the condition that is being treated. So for example, for the hypertrophic port wine stain, where there is a nodular component, or the so-called blebs of the port wine stain, these blebs can be treated with the long pulse Nd:YAG, targeted treatments, so tracing the individual blebs of the port wine stain with the 1064 Nd:YAG, and then after, for the remainder components of the port wine stain using the pulse dye laser with the 15mm spot size. There is also a relatively recent publication published in the Journal of European Academy of Dermatology and Venereology using the combination of the Vbeam Perfecta 595 and the gentle YAG from Candela, the ND YAG, and the pulse dye laser in hemangiomas, where the thicker components of the hemangioma was treated with the 1064 and the more flat components with the 595. That was published, and therefore certainly the combination can be used. So in one single patient, there might be a deeper component that you can treat with the 1064 and a more superficial component that you can treat with the 595. Another question, if you would always use the 15mm spot size and rosacea. Yes, well, so as I say, the larger spot size, the 15mm spot size, allows for speed. This particularly will be useful off the face if you have, for example, a large birthmark or port wine stain on the arm or on the leg. And using a large spot size will be a faster coverage. But one of the things, and as you saw in the publication that was published in Laser Surgery and Medicine, that using a larger spot size will allow you to have more homogeneous, deeper penetration, whereby we are targeting also more homogeneously deeper components of the vessel. So yes, for rosacea, poikiloderma, I tend to, on port wine stain, tend to start with larger spot size, so the 15mm spot, and then afterwards, depending on the chromophore on the target and the depth, thereafter I might move to a smaller spot size, such as 10mm, but yes, I start with the 15mm. There, some questions are duplicates, but there is a question about contact cooling and when to use contact cooling. Okay, now so there are doctors who are used to devices with contact cooling, and they feel very comfortable using that method of cooling. And if that is the case, then you can, of course, use the contact cooling for all the indications with the Vbeam Prima. There are doctors who are also very used to DCD, cryogen dynamic cooling device, and therefore they can simply just continue using the DCD. But from my personal experience, using now the Vbeam Prima with the two different cooling methods, I prefer to use the contact cooling in patients who are very sensitive, have very sensitive skin, and particularly do not like that spraying required in the pulsation. And they find with the contact cooling, as there is also a gel that is applied for the gliding gel, that is more comfortable. So for the patient's comfort, I tend to use that. I also prefer to use the contact cooling when I'm treating dyschromia and brown components. And I also like to use the contact cooling also in a way where I treat with some compression, for example, with a spider angioma or a venous lake, where I would like to have that compression element, and I can use that using the contact cooling. Once again, with the contact cooling, you are able to adjust the degree of cooling that you would want. So you are able to choose the degree of temperature and cooling that you would want the epidermis to be cool. Particularly useful when you're using the Nd:YAG at higher fluencies, then the contact cooling will allow you also, for example, to have perhaps some slightly longer contact afterwards, to be able to cool the skin afterwards for a little longer. There are some questions about settings. In terms of the settings, there is the interface, or the guided user mode, is available in the Vbeam Prima with both the 595 as well as the 1064. So for both the pulse dye as well as the Nd:YAG, there is an interface guided use where you can, there's a drop-down menu, you can choose for different applications, and it gives you the setting that is used. And I have checked this, and I'm very impressed with the settings, as well as an expanded application setting from the Vbeam Perfector, such as, for example, for dyschromias and the case of post-injections bruising. So the settings are there, and they are available in the guided mode. Some repetition questions on the contact cooling and on the large spot size, the dye. The dye is the same, so it is the same. It's rhodamine dye, but it is more efficient compared to the Vbeam Perfector in terms of lifelong. So it's the dye life is longer, and you are able to track how much dye there is left with a monitor tracking system. Can you switch from DCD to contact cooling? So there are two different fibers, and yes, you can, but there is a fiber handpiece for the DCD, for the dynamic cooling device, and there is a separate fiber that is for the contact cooling. So you are able to change between the DCD and contact cooling, but you are going to have to change the fibers. But for the spot size, as I explained, you can just change that within the handpiece. So you can just literally, with your finger, just dial in and incrementally increase or decrease the spot size by 0.5 millimeter. And this is something that I am routinely doing with vessels and areas whereby some areas might use a larger spot size, and for the more smaller areas might just adjust and use a smaller spot size. So you are able to dial this in with great ease. So really, and most of the other questions are a repetition of the questions that have already been asked. But yeah, the Vbeam Prima is a great vascular device. It's a complete vascular device, and in my opinion, this is the greatest vascular device that currently exists in the market, which allows you to treat all vascular indications with all different settings. Now, with this, I conclude the webinar, and I would like to thank you all for joining us and listening to this webinar. Once again, this webinar is recorded and will be available for access at any time. And I'd like to thank you once again, and have a good day.